For our pediatric project, we decided to research the disorder Angelman Syndrome. Angelman Syndrome is a disorder that causes developmental disabilities and nerve-related symptoms. The occurrence of the syndrome is very rare. It is so rare that it's only 1 to 12,000 to maybe 20,000 incidents of this disorder. Angelman syndrome is not noticed until an infant is usually between 6 months to 12 months.
The pathophysiologic changes associated with Angelman syndrome occur during egg and sperm development or during early embryonic development. 70% of the cases of Angelman syndrome are caused by deletion of a segment of chromosome 15, which houses the gene UBE3A. 11% are caused by a mutation in the maternal copy of that gene. 10 to 15% of the cases are of unknown causes and are likely caused by other gene mutations. And there's a very small percentage caused by uniparental distomy, which is where the child ends up with 2 paternal copies of the UBE3A gene instead of a maternal and paternal copy. 80 to 85% of Angelman syndrome cases are diagnosed with blood tests, which detect the activation or inactivation of the UBE3A gene. 15 to 20% are diagnosed with the expert in the clinical manifestations of Angelman syndrome.
Clinical manifestations include a smaller than normal head circumference, abnormal facial features such as sunken nasal bridge, smaller chin, prominent lower chin, and a wide smile. Vision defects include strabismus, but is not limited to. Development delays include severe learning disabilities, walking delays, inability to support one's head or pull oneself up. They also have speech problems such as the inability to communicate. Some children are only able to speak a few words and only understand simple commands. Also, abnormal movement and balance is an issue, which is also an issue for risk for injury. They are unable to maintain a steady balance because of the jerky movements due to the inability to coordinate voluntary movements. They may hold their hands and flap they may hold their hands up and flap their hands when excited or walking. They have an unusual happy demeanor, which includes prolonged laughter and unprovoked smiling. Adults with this disorder usually have very fair skin and light-colored hair. Also, another issue is that they are at risk for seizures.
Complications of Angelman syndrome include a hyperactiveness, which with their enhanced excitability and their short attention span and their involuntary movement, they will be hyperactive, which can contribute to their feeding difficulties because the infants could have a impaired suck and swallow coordination and excessive drooling. The hyperactiveness could also contribute to the sleeping difficulties. These children have a very offset circadian rhythm, and they require much less sleep than the average child. They have a spine curvature that they tend to get over time, and later in their years, they could lead to scoliosis. They are at a big risk for seizures, which has been mentioned already. The seizures are a very big part of their disease process, and seizure precautions should be taken. And this can lead to a very great risk for injuries.
Treatment for Angelman syndrome. Currently, there is no cure. However, treatment aims to manage the medical and developmental issues of the disease. Treatment include anti-seizure medication to control seizures, such as clonazepam, physical therapy to help with walking and movement problems, which helps restore muscle strength and function. Communication therapy, such as sign language and picture communication. They can also see speech therapists to help with voice rehab. We have behavioral therapy, which helps overcome hyperactivity and attention and short attention spans, which helps with development. And occupational therapy is not picture, but it helps improve the daily living and work skills. All of these treatments are important in allowing the individual to reach their maximum potential.
Angelman syndrome does not compromise the immune system, so children with Angelman syndrome are under standard precautions just as those who do not have it. With good proactive care, these children should have a normal life expectancy. They are, however, at risk for early death due to seizures, aspiration, pneumonia, and chronic and restrictive lung diseases.
Disease prevention really starts before birth, and it includes genetic counseling. It's recommended to detect the mutated gene UBE3A. And if you have a child that has already been born with this condition, then it's very imperative to have this genetic counseling done before any future pregnancies.
Case study. Jane Doe is a 45-year-old mother of two. She has a 22-year-old daughter and an 11-month-old son, Blake Doe. Her 22-year-old daughter, Sarah Doe, is currently in nursing school enrolled in a pediatrics course. She was recently assigned to perform a Denver developmental assessment on an infant of her choice. This assessment is used to help determine if an infant has developmental delays or if they are up to par. She eagerly decided to do her assessment on her 11-month-old son. Brother.
While assessing her baby brother, Sarah noticed some inconsistencies. She never did notice how unstable her brother was while sitting up on his own. While assessing his motor skills, she observed him drinking from a cup, which he had very loose control of, and when drinking from the cup, he drooled excessively. She never could teach her little brother to wave bye-bye, so this was a surprise to her to see that this was a milestone for him at his age. When playing patty cake, he could not completely meet his hands together. So she placed 2 blocks in his hands to see if he could bang them together. And he failed at this test as well. Her brother jabbers a lot, but she could never really understand him. The only word she could understand that he uttered was no. So after finishing this exam, Sarah was burdened with the thought that maybe her little brother could be developmentally delayed, and she decided to talk to her mother about it.
After being diagnosed with Angelman syndrome, the registered nurse considered many nursing diagnoses appropriate for the 11-month-old. Based on the signs and symptoms that were inconsistent for the toddler's age, the top 4 nursing diagnoses include risk for ineffective airway clearance or breathing patterns, risk for injury or risk for falls, delayed growth and development related to physical disability, and impaired verbal communication related to developmental factors. The RN also notes that activity intolerance and impaired physical mobility are also considered for the care of this individual.
In accordance with the 4 diagnoses, the nurse creates a plan of care for Blake Doe. The registered nurse first explains to Mrs. Doe that there is no cure for her child's syndrome, but a group of health professionals will work with her and the family along the way to manage Blake's condition. To control Blake's drooling, monitor him closely and always carry extra napkins or bibs, says the nurse. The nurse then instructs Jane on how to use a bulb suction to remove excess saliva so Blake will not choke on it. She then schedules an appointment with a physical and occupational therapist with Mrs. Doe's consent so that Blake can get started right away to help with his gait problems, growth, and fine motor skills. The nurse tells Mrs. Doe that their next step will be to schedule speech therapy for Blake if he is not able to speak words by his first birthday. Mrs. Doe asks what other future challenges and problems she should anticipate. Seizures have shown to occur in children with Angelman syndrome around ages 2 and 3. We will talk more about seizure medications and what to do in the event of a seizure when Blake is approaching such age. Let's focus on what we can do right now so you won't be overwhelmed, explains the registered nurse. The registered nurse suggests that Mrs. Doe considers joining a support group or speaking with another parent whose child has Angelman syndrome. The nurse gives Mrs. Doe a pamphlet from the Angelman Syndrome Foundation with contact information. The nurse also stressed the importance of making sure Jane and Blake attended the appointment with the physical therapist. She made sure Jane was aware that physical therapy would help with Blake's ambulation. Jane was also made aware of the importance of keeping all visual exams. This is the best way to help early correction of any visual defects and help manage strabismus. The nurse made sure to go over the seizure precautions with Jane because she seemed at such unease by hearing the word seizures. So she told her in the occurrence of a seizure, make sure the infant is in a safe environment and to make sure the airway is clear. Do not put anything in his mouth and to notify 911 if the seizure lasts longer than 5 minutes. The nurse made sure Jane was not overwhelmed by stopping and letting Jane ask questions if necessary. She also made sure to pay attention to Jane's body language. Jane appeared to be in full attention and writing down brief notes. Lastly, the nurse emphasized the need for sunscreen due to his fair skin. Jane gave the nurse a smile before exiting the room. She told the nurse that she felt more at ease about helping her son manage his disorder.
Blake Doe has It has been a few months since Blake Doe's diagnosis, and now his mom never leaves home without bibs, napkins, and a bulb syringe to manage Blake's drooling. He has experienced no choking episodes. Blake also attends physical and occupational therapy twice a week, and after 3 months of toning exercises, he has shown an improvement in his gait. He attends speech therapy once a week. In the beginning, the only word he could or would say is no. He now uses more yes and ma. Fortunately, Blake has not experienced any seizures. His mother and father attend a monthly support group in a neighboring state about 75 miles away. Blake is left with his aunt, who is familiar with his care. Along with socializing with people that are in a similar predicament, it helps combat caregiver role strain.